Guidance for young viewers.
Need some appreciation. You need to feel the love. Your last day a special one, Ange.
Thought, boss?
What?
Evidence.
DNA? You don't reckon it'll be worth it? Give me one of those. They'd have to find it first. And I reckon what we've got planned for her, there's no way in hell.
Kane!
Kiki! Hold on. Hold on.
Kane!
I got you. I got you. I got you. Too big.
Come on.
So the last thing you remember is going to Miss Jeffrey's apartment. Then what?
Went 10-pin bowling, finished a crossword, baked a cake.
This is a murder inquiry, Miss Piper. You can take it seriously now or in the dock. It's up to you.
No, Myers wasn't the last place I went. I went to Ethan's.
Are you sure? You were very drunk when you left
Very
me.
sure. I took a gun from his drawer.
Alice, don't do this. You need a lawyer.
What next?
I woke up here.
Did you intend to use the gun on Dr. Pierce or just threaten him with it?
I don't know. Do your job, work it out.
I think you need to rest. Can you do this another time?
Why? It's not hard. Motive, I hated Ethan's guts. Opportunity, I had a gun. Result, a corpse.
Enough talking. You need a lawyer.
I don't care. Maya, I really don't. Throw the book at me.
Is he breathing?
No.
Is he dead?
No.
Come on, Kingy! Is anything happening? We're too late!
Oh, that's it. That's it. Oh, you're gonna be fine. You're okay.
What?
Come on. Yes.
So, can I go?
Tracy took your bloods for the toxicology screen and ethanol levels.
Blood's taken, still waiting on fingerprints. Where is Bill? I was hoping for handcuffs about now.
Before you go, I think a psych consult would be in order.
I'm nuts. I'll give you that much for free.
Look, you've been through a trauma, so I'm with Maya. I'll call Jess down from psych.
Well, she'll tell me exactly the same thing as I'm telling you. I'm certifiable, but unfortunately still sane enough to know it, so no consult.
Okay. But you're coming home with me. No arguments there.
I need to go to Ethan's to get my stuff.
It's a crime scene now. They won't let you.
Another crime scene. Just when my horoscope said things were looking up.
I heard about Ethan. How's she doing?
You know, Alice, all brave front, but terrified underneath.
Do you want to go after her? I'll handle things here.
Pregnant and with MS, sure. I feel fine about that.
Being busy helps both things, and besides, I am taking back the ED reins.
Oh, is that right?
It's numb, but I can handle it. Cubicle 2, febrile with erythema, swelling of a left calf. I've got it. Hi, Claudia. I'm Sarah, one of the doctors here. Now let's have a look at that leg. Ooh. How does it feel here?
Sore.
Yeah, and hot. Did this start as an insect bite?
Yeah, about 4 days ago.
Okay, can you take a wound swab and send it to the lab? Claudia, I think you have something called cellulitis, which is a skin infection, so I will start you on some IV antibiotics, and Tracy here will look after you.
Thanks.
Well, any faster and you'll show me up.
Never.
Miss Jeffries, hello again.
What can I do for you today?
Your boss man is Ian.
Dr. Mackay, you want to see Dr. Mackay? Good, that's great.
Are you all right?
My mother has cancer.
I'm sorry to hear about that.
Yeah, it's awful. It's horrible. I'm a nervous wreck. This way, please. Dr. Mackay, Detective Lamont here to see you.
Of course. Please, come in.
Please, take a seat. This is regarding Dr. Pearce's death, no doubt?
Yes. I'll need access to his exam room. All files.
Of course, anything you need.
A room to interview staff also.
Except that. The Joey Henderson affair turned this place into a circus. I'm loath for that to happen again.
Well, staff work hours are disrupted less if we interview on site. They don't have to travel to and from a police station.
Yeah, and that's my problem. We become the police station, not a hospital. Our work needs to come first.
OK. You're cool then.
Thank you for your understanding.
Callum, good. I'm sorry, she wouldn't wait.
It's OK. We're done here.
For now.
Of course. Libby, would you show Detective Lamont to Dr. Pearce's exam room? Full access, but with security present.
Certainly.
The Pierce business?
I'm afraid so. I guess that's why you're here.
No. The DHB are standing you down.
What?
While they make a full inquiry into Nessa's bio.
Now, hang on. This crisis needs an experienced CEO at the helm, not some novice fall guy.
It's what the DHB want. It's what I want.
Helen, it's a mistake and a PR nightmare.
We're getting used to those, thanks to you. Your replacement will be appointed shortly.
Forget about him. Just make your way up to the van.
Give me your shirt.
What for?
I have to stem the bleeding. I got a cell phone. No signal, though.
Come on.
We have to take him with us.
The hell we are? You got me good.
We'll get you to hospital as soon as we can.
I'm gonna get you.
What did you just say?
Don't listen to him. Just walk away. We've got business to take care of. You and me. He's got the picture. Dance! Come on. Come on. That's enough.
You should be careful what you say to the police.
I'm just telling them the truth.
You didn't kill Ethan.
How do you know? You weren't there.
I know you could never take another person's life.
Well, that's for the police to decide, isn't it?
No. You need to try and remember what happened at the apartment, what you really did.
I don't care about all that. Let them build a case against me. I'm too tired to fight.
So you're going to just throw your whole life away rotting in prison?
An all-women prison. No men. Sounds like heaven right about now.
Ethan robs you of everything, then your whole life. Is that what you want?
Right now, what I'd really like is a biscuit to go with this tea.
I'm serious. Let me help you find a lawyer.
Just leave it.
No! You have been through too much and come out fighting too often to throw it all away now. I won't let you, Alice. I won't.
Okay. Okay, I'll get a lawyer. They can have a biscuit.
How far did they fall?
4 metres onto concrete.
What, all three of them?
Yeah, Amber handover system scaffolding gave way.
Okay, you take the head injury to resource.
Done.
Andy, can you take the query fractured pelvis here to cubicle 3? And I'll take the fractured femur. Hi, Mr. Gillespie. I'm Sarah. I'm one of the doctors here. How's he doing?
Hypertensive and tachycardic, systolic of 80, pulse 110.
Okay. Well, he's going to need some trauma views, and I'm going to have to put another line in. Well, looks like the ambos have used the only decent vein in your arm, so I think we're going to have to put one in your neck.
Will it hurt?
All needles hurt a bit.
Yeah, we've got critical for radiology. Tracy, you did.
Yeah, about 10:15.
Do you need a hand? Would you like me to get somebody else?
Yes.
Hey, Andy, can you help me put a line in, please?
You must be exhausted.
Yeah.
Shanti said she was really brave.
Not brave, just desperate. She's the brave one. After everything, and now Ethan.
Gets worse. She thinks she killed him.
What? No, she wouldn't.
Of course not. Why would she think that?
She was really drunk and she went to Ethan's apartment and she doesn't remember pulling the trigger, but she doesn't remember not doing it either.
Alice isn't a killer, no matter what she's done.
I know, but it's like she wants to be guilty. She's told the police to start building a case against her. That's crazy. She needs a good lawyer.
Fraser, he'll help her. And I'd feel better knowing it was someone that we knew and trusted.
Yeah, I thought that too.
I'll ring him.
No, you need to rest. I'll do it.
Oh, his number's in there.
Come on, Mum, have a lie down. I'll make you a cup of tea.
A very weak cup of tea, thank you. Have you heard from Tanya? She was meant to visit me in the hospital, but...
No, nothing.
That's odd.
Well, I'll chase her up, don't worry.
Take Kane through to recess and we'll get him some pain relief. I'll be there in a minute.
Well, given what he's put Tony through, I reckon it'll be a go-slow on the pain relief, don't you?
I think nurse, not cop. Get to it. I'll need to check you out.
I'm fine.
Yeah, I'll decide that. Just stay here until I check you out, okay?
Hey. Are you okay?
What do the police say?
Not much at the moment, just taking statements. I put a good word in for Tupac. If he didn't help us.
I don't want to think about it.
Yeah. But it's over. Let it go.
I could still throttle them both.
You sure showed Kane, laying into him like that.
Well, what did you expect? He was going to kill me after he...
Hey, I'm not saying he didn't deserve it. It's just, I've never seen that side of you before.
I lost control.
Yeah. I know that feeling.
What do you say? That I'm like you? Well, I'm not. Okay?
So just the one night, then?
For now, I'll let you know.
Not even one night. Come back to mine.
Yeah. You, me, and Harry. The perfect combination.
Please, you've had a major shock. I don't want you to be alone.
Yeah, come on, Chris is right. You need a friend right now.
Except we're not friends, are we? We're not anything. Not anymore.
I still care that you're all right. You need some support.
Legal support?
That, as well as emotion.
You think I killed Ethan, don't you?
No, not at all.
Alice killed him.
No, she didn't. You shouldn't go around saying things like that.
Alice Piper selfishly murdered a brilliant, intelligent man, and I hope she rots in hell for it.
A brilliant, intelligent man who ran out of surgery, leaving a patient to die. And then there's Nessus.
I've always been jealous of Ethan.
Let's not talk about this now.
Because it's the truth?
Because you're clearly upset and you're saying things you don't really mean. Come back to my place and get some sleep.
Get out of my way, please.
Brooke, I want to help you.
Then get out of my way.
I've been thinking about the tests for Junior.
Yep.
Well, it's nearly 2 months before I can have an amnio, so CVS is the way to go.
Isn't a scan enough?
It's not conclusive enough, and there's no big risk in having a CVS.
Well, there's still some risk. And I really don't think there's a need. I mean, you're not old enough. You've had a baby before. The chances of this having any defects are so low.
Can I tell you why I think there's a need?
Sure.
Having a newborn is really full on. Sleepless nights, and I might not be so good after, just for a couple of months. I might not be able to hold our baby properly and pick it up.
You've got a numb hand now, but it's not going to stay.
Yeah, no, but what if
Look,
something is wrong with the baby too? Imagine what a pair we would be. I just want to have the test.
Okay. Look, I know that Junior's going to be absolutely fine, but... Okay, you have the test.
It's all his fault.
No, Mum, he was abducted too.
That man has been nothing but trouble since
He nearly died. For me.
When will you wake up and stop defending that thug?
Libby. He was in respiratory arrest. I had to give him mouth to mouth.
It's all right. You're safe now.
Oh, Mum, I'm sorry. This is the last thing you need.
Don't you even think about it. What you've been through...
Gave Kane a hiding. Nailed him. No less than he deserved. No, I really lost it. I went totally mental.
Any one of us would have done the same.
I don't think so. I mean, Maya maybe, but I wouldn't, Mum, and you
Whatever, Libby. Just forget it. You're being far too hard on yourself.
Except it's not the first time. That self-defense class I went to when Joey was on the loose, I went totally ape at that punch bag.
And when you slapped Maya, when you found out that Mark got her pregnant.
Libby?
It just sprang to mind.
Thanks.
Yeah. That's just what we needed to hear.
It couldn't possibly have been Alice. I don't care what she says.
And Ethan had a lot of enemies just in the short time he was here.
Oh, exactly. With his dodgy past, there must be a swag of people who have it in for him.
Enter the dodgy past. Don't mind me.
I didn't think you'd be back at work so soon.
Didn't you?
I can cover the PCC for a few days.
I'm fine. But thanks. That is not fine.
I tried to help, but...
Is she still staying with you?
No, she wouldn't. She's at the IV.
Well, doesn't she have a friend somewhere?
I don't like it either.
Oh.
I have to go. I'm working through some of Ethan's list.
See you soon.
See ya.
Morning.
Morning. Hey, Callum, good news. I'm not resigning anymore.
I'm sorry, Sarah. It's out of my hands. I've accepted it, and it's going through the proper channels now.
But things have changed for me, and I want my job back.
Yeah, that's not how it works.
Oh, come on. There must be something you can do about it. That's why you get paid the big bucks, isn't it?
That's right, to run the hospital according to its governing principles and protocols.
It's the MS, isn't it?
No, it's because you gave me your resignation.
I can still run ED. My role would be more administrative, but with Kip as my 2IC, I can still manage the floor.
Sarah, don't waste your breath.
But he's really stepped up, and I know with him at hand, I can do the job.
But I'm not doing mine.
What?
Even if I could reconsider your resignation, I can't. The DHB are sending in a temporary replacement.
Why?
Some neutrality in their Nessus investigations.
Well, who's going to be your replacement then?
Watch this space.
Thanks for the offer, but I'm going to defend myself. If they ever get around to charging me, that is, slowpokes.
Yeah, that's not a good idea.
Listen to Fraser. He's the best in the business.
I know. And I will need your help.
So, let's start by pleading innocent.
To negotiate a sentence when they find me guilty.
Alice, remember what we said last night? If you give in, Ethan has won.
I don't remember much of last night, to be honest. Or of anything, really. And I don't want to.
Not interrupting.
I'm in between patients. What can I do for you?
Sarah and I heard you were staying at the IV. We'd like to offer you a room at our place. It's not flash, but it's home.
Really?
The room's just sitting there. We won't be in your way. A rough time like this, the last thing you want to be is on your own.
But we're not even friends.
Well, we better start. Look, you don't have to decide now. When you're ready.
No, I'd like to.
Oh, good. Well, I'll come over after work. We'll grab your stuff and head home.
Okay. Thank you.
No worries.
You probably worked out that something wasn't quite right. My brilliant work at putting a line in yesterday, for example.
I did, yeah, but I never thought MS. So it's not a sprain, then?
No, it's been numb. It's been numb for a while.
You knew?
Yeah. Time's loud out there.
I'm afraid so. I never willingly compromised patient care and safety.
Oh, no,
and
of course not.
But I'd hate you to think I was negligent.
Wait, there've been a few hiccups along the way, but never anything compromising. Now that I know, hell, you've done brilliantly.
Thank you. But I can't guarantee that I won't mess up somehow and sometime soon. So...
ED Kip Denton.
Yeah, she is.
You'll be missed.
Okay, I'll see you.
Thank you. I'm gonna miss you guys too, more than I can say.
That was Libby. Callum wants to see you.
Right, well, I'm still on the payroll, so I better jump to it.
Place won't be the same without our Dr. Potts.
No, one of the best.
Hey, no, it's on the house.
Are you sure?
Please, for everything you two have been through.
I think I have a problem with violence.
You? No way.
Yes. Like beating up on Kane. And my family reminded me that it's not the first time.
When else?
I slapped my sister once. Hard. And another time I went completely burko at a self-defense class.
Yeah, you're a lethal weapon.
I'm just saying, I can see now how stress and feeling powerless can lead to lashing out, sometimes physically.
We're talking about when I clocked you now.
No excuses for that.
But everyone has a breaking point. I'm just saying that I can see that better now.
Kane's going to be locked away for a very long time.
What does that mean, for you and the White House?
Don't know about them. But as for me, I'm free.
So, will you be staying in Ferndale?
I guess. I've got a law degree to finish, haven't I?
Yeah, you do.
And I have to stick around because I owe someone dinner. You know, for saving my life.
Dinner, and then some.
Hi. Look, if this is about me asking for my job back.
No, it's not about that, but that's all I know.
Take a seat, please, Dr. Potts.
Okay, so now I'm nervous. What have I done?
Nothing. It's what you can do for us. We would like to offer you the role of acting CEO.
Come again?
The DHB wants you to run this hospital, as of now.
How'd it go?
Let's just say Fraser did the best he could.
Meaning?
If she's charged, Alice won't let Fraser defend her.
Not if, but when I'm charged, I'll be prison packed and ready to go.
No, don't say that.
I'm sorry, Yvonne. I don't mean to upset you.
You can't give up like this.
I'm sure I did it. I have to face that.
You blacked out. You don't know anything for sure.
I wanted to kill him. I know that much.
So you're determined to make your life a misery, even if you didn't pull the trigger? Because you think that's all you deserve. Misery. I know you, Alice Piper, and there isn't a bad bone in your body. You have been to hell and back more than once this last year, but it is just horrible, cruel luck. And you haven't deserved one single piece of it.
Why does it keep happening?
I don't know. You will be happy again. You have to hang on to that. Don't just throw it all away now.
Throw what away? I have nothing. I am nothing.
No, you are a young woman with everything ahead of her.
Yeah. Prison.
You remember when Kelly was in hospital and I promised that I would stand by you forever? Well, I'm as good as my word. Now I need yours. I have cancer and I am fighting for my life. Fight with me, Alice. Please, fight, Alice.